Ladies and gentlemen, please welcome Mr. Kent Blad.
It is my pleasure to introduce Dr. Joanne Disch, who will present this year's William Shoemaker Honorary Lecture. Dr. Disch is Professor ad honorem at the University of Minnesota School of Nursing. She received her degrees from the University of Wisconsin at Madison, the University of Alabama in Birmingham, and her PhD in nursing from the University of Michigan. Starting her career as a staff nurse in cardiovascular intensive care, Dr. Disch has served as a chief nurse executive in 2 major medical centers, as interim dean at the University of Minnesota School of Nursing, and as president of the American Association of Critical Care Nurses and the American Academy of Nursing. A former chair of the National Board of AARP, she is currently chair of the board of directors of Aurora Healthcare in Milwaukee, Wisconsin, and of Chamberlain University. Please join me in welcoming Dr. Disch as she presents the William Shoemaker Honorary Lecture, Rethinking Mentorship.
Good afternoon. And I'd like to thank the Planning Committee and SCCM for marking my 50th year as a critical care nurse, so notably. This June, it will be 50 years, and thank you. And I do consider myself a critical care nurse. Fortunately, for patients and their families, I have not touched them personally in many decades, but wherever we start our career, we often use that as the lens that we go throughout the rest of our career. And so I am a critical care nurse, and so pleased to be here. I also knew Bill Shoemaker and a lot of the people who are being honored here. They were my colleagues. And so this is a very special occasion. So thank you for sharing this anniversary with me. Today, I wanted to do some reflections on something that I hope cuts across every profession and discipline that's represented in this room, and that's the idea of mentoring. The slide says mentorship. That was the title that was given to me, but when I thought about it, I thought really it's much more of a fluid process. Mentorship to me is kind of static, and so I wanted to talk about mentoring and invite you to think a little bit about the mentors you've had, who might be a mentor, depending on where you are in your career right now, and then who could you mentor? And so that's really going to be the gist of my comments. Back in the day, the 1960s, things were somewhat similar and somewhat different to what they are today. Everybody cared about the patient. Now that's true today too. And also, we all shared a common goal, quality patient care. But there were some differences back in the day, things that we had that I don't think are in much abundance today. One is we had unbelievable time to provide that care. We had patients in the ICU who might be getting a single bypass graft, which they don't even do now. You could probably drive through the clinic and get it with your arm outstretched. But a single bypass graft would be in the ICU for 4 weeks. So there was a lot of time to develop a relationship and get to know the patient and the family. We also had unlimited resources, costs. And in fact, there was an article back in the day, the American Journal of Nursing, the title was, "Healthcare Costs Are Too Low." So I think we fixed that problem in the ensuing years. So they are not too low now. So we had unlimited resources. And another thing we had in abundance was the opportunity to forge really strong relationships with our nursing and medicine and pharmacy colleagues. Now, not that that can't be done today and is done today, but we spent so much more time together. There wasn't the competition of 12-hour shifts, so you'd work with the nurse and not see her for 7 days, or residency schedules, or all manner of other kinds of things that prevented people from connecting. We also essentially had nurses, physicians, pharmacists, and social workers. There was no respiratory therapy or IT or any of the other kinds of specialties that have had to emerge. So we had a number of things that aren't really abundant today. Conversely, we didn't have as much of a problem with burnout. We had stressful days, but again, spending a lot of time with your colleagues, both in nursing and across the disciplines, really enabled rich teams to form and be sustained. So it was different. Technology was just emerging. Very primitive technology, I might add, but it was functional. We had to manually check blood pressures. This, if you can read it, is about interprofessional education in the ICU and the idea that nurses and physicians learned about monitors together. And nobody really knew too much. There weren't any continuing ed courses. We got the monitor and they were like, well, what do you think that means? I don't know. I've got this textbook, and it could be the nurse, the physician, the pharmacist. Everybody was kind of learning together. And that was among some of the earliest interprofessional education in the ICU. Who could this be? I'm not on the left. That would be Dr. Pami Chopra. I would be on the right when I was the head nurse of the ICU. Now, this is what we all aspired to look like. Those of us who were women aspired to look like this, and this is actually what we look like. Now, you can imagine why we quickly moved to scrubs, because it was not always a pretty sight when the nurse would scamper on top of the bed to do CPR. It was not a pretty sight at all. So we moved into scrubs, and again, another good innovation that occurred in healthcare. So what I'd like to do today, as I mentioned, is to talk about a couple of things. Who were your mentors? A colleague of mine, Mark Kelly from the Hospital at the University of Pennsylvania, we used to talk about in the days of the giants. He was in internal medicine, and he said, those days when you learned at the feet of your idols. So I'd invite you to think about your own days of the giants. Who were your giants that really made an impact and helped you get to where you are today? And have you thanked them if they are still with us? Have you thanked them, sent them a note, or told them in some kind of a notice or a commendation how much they helped you? I also want us especially to take a look at who could be your mentors today. What might you need mentoring in? And then finally, who could you mentor? So that'll be the focus of these things today. Now, the concept of mentor, and normally I have to say, maybe you know this, I'd be walking around here a little bit more, but there is like a 2-foot square thing, so I'm going to just tilt one side to the other, which is my equivalent of moving around. But mentor is a Greek term, and it came from the Odyssey, where Odysseus asked Mentor to watch after his son while he went to the wars. So the idea of somebody watching after you when you are younger and bringing you along this path is what we consider to be a mentor. These are my two mentors from my earliest days in critical care. Dr. William Young, who was head of CV surgery at Wisconsin, and then Rocky Schmitz. Now, each of them in their own way taught me a lot about being a critical care nurse. But they also were mentors for a couple of other things. Interprofessional collaboration. They modeled it from day one. They were a force to be reckoned with together. And there was no triangulating. There was no talking negatively about the physicians because Dr. Young wouldn't tolerate it. Similarly, we wouldn't be allowed, the physicians weren't allowed to talk negatively about the nurses. We were all in this together. They modeled high standards of patient care that when I look at hospitals today that are trying to do some of the things that we did then in terms of teaching patients to take their own medications, having the chart at the bedside. So a lot of progressive practices, they just felt if the patient and family are at the center, then that's how it should be done. Now, a couple things I've learned since then, we didn't do so well. We did have families only come in for 2 minutes every couple of hours, and then we sent them home to rest, take care. Well, we know that's not the case today. So there wasn't perfect, it wasn't nirvana, but it was very good, and those are my mentors from those early days. The idea of mentor is shared with a number of different relationships that this article that's highlighted here talks about protege support. And this is really a review of mentoring in academic health centers. So it's a fabulous article that was written by these authors. But they talked about all of these different kinds of relationships that we might be engaged in, coaching or advising or supporting or mentoring. But they all share some things in common, but they also are somewhat different. And one's not better than the other, but we might use them at different points in our career for different things. We're all pretty familiar with precepting. But that's a very different relationship from a mentoring relationship, which is usually a little bit longer, is more about helping people move down a path rather than learning a specific skill. And again, there may be areas of overlap with those two kinds of relationships. But the whole idea of these are forms of protege support which exist today. Now, variability is good that we have so many relationships, and even mentoring, that definition I gave you, can be operationalized in many different ways. So the variability of what we even mean by a mentor poses some problems because it's hard to research the impact of mentoring. It's also hard to set up best practices when we're not totally sure the parameters and what do we consistently mean by mentoring. And then third, if an organization, and increasingly we're seeing the importance of organizations in structuring supportive relationships that can allow mentoring, so it's not just aberrant off on the side by two people, but putting in place predictable, structured relationships in an organization, it's hard to do if you're not quite sure what's in the ballpark. So variability is good, but it can pose some problems when we're talking about something like mentoring, which in itself is really heavily based on a relationship. So it's not always quantifiable by a yardstick or by a scale. We do have some data, largely coming out in the last 10 years. Pololi and her colleagues have done a lot of work on mentoring in the health professions, medicine and the other health professions. And so we see in one study in 2015 that 43% of the respondents felt they had inadequate monitoring. So that still means that more than 50 did. But of those who weren't monitored, 58% of those considered leaving their organizations. These are largely, in this group, caregivers and physicians. Faculty Forward Engagement Survey, a phenomenal, very rich database of thousands and thousands of clinicians and faculty, found that 1/3 of clinical respondents, clinical faculty, had a mentoring relationship. So the majority did not. And then so many that are in what they would consider a mentoring relationship felt it was very helpful to them. And then the last data only represent the fact that we have underrepresented mentoring going on in our health systems and in our schools of medicine and nursing, whether it be individuals of color or whether it be women. And the last statistic that was shared was not only are they not having mentoring experiences, but 22% reported that they had experiences of discrimination. So clearly there's a lot of work, there's a lot of value, there's a lot of benefit. People who are in a mentoring relationship, however they define it, find it very rewarding if it's a good mentoring relationship. And so it's good to the individual, to the mentor, to the organization, and really, I would say to the profession, because we also know, and I'm more familiar with the nursing literature in this regard, that if somebody has a very bad relationship with either their nurse manager or somebody who is important to them, a preceptor, they may leave nursing, not realizing that it's not nursing is the problem, but really it's the particular situation. So we can't afford to lose one physician or pharmacist or nurse if we could prevent it. So the idea of mentoring, I would say, has shifted certainly from back in my day to the present, and even in the last 20 or so years of my career. I'm responsible much more now for bigger system structures, but the idea of historically mentoring being an option, it was a nice thing to do, it was sort of a personal connection, it wasn't intentional. The other thought was that you had the mentor for life. You know, I will be your mentor, you will be my mentee, and we'll be joined at the hip forever. Well, some of that may be true, but the idea of ad hoc mentoring, which one of my mentors, Claire Fagan, who had been the interim president of the University of Pennsylvania, talked about. She introduced me to the concept about 20 years ago, saying, you know, ad hoc mentoring is a good thing because at this point in your career, you need this skill set. But if you're a clinician and all of a sudden you're moving into an administrative role, maybe having a mentor who is the COO of the organization would be a very good thing. And so you may have had your clinical mentor getting into your profession, but now you really want more of an administrative mentor or a research mentor or a couple of people at the same time forming a mentoring team. So I think we're seeing some new ways to appreciate what mentoring can offer us, and then also how to look at mentoring, how to evaluate it, how to seek it out and use it to advance our own careers. Because again, careers are so much more complex than they were from when we started our professions. So what to look for in a good mentor? And I did ask a number of my physician colleagues, since the majority here would be physicians, to say, what do you look for? And so when there are periodic quotes that are italicized, those are from some physician colleagues. And one physician colleague said, good mentors guide, bad mentors diagnose. And this study by Tian didn't look at healthcare providers. It looked at 100 business leaders and asked, what did they look for? What was present in a good mentoring experience? And I don't know if any of these surprise you. They don't particularly surprise me, other than maybe the last one. The relationship's important. We're trying to help people for the long haul. It's not about learning a specific skill. But the point that he made here was that a really good mentor is really very loyal to their mentee, almost more than the organization. And his point was, sometimes the best help you can provide a mentee is to say, you know what? I think you're right. This isn't working. It's not your imagination that you're not a good fit. And you might be better off seeking a new position someplace else, because that's what the mentor needed. I remember a colleague of mine who was feeling she was being pushed out the door. And so she said to her, three of us were having coffee, and she said to her mentor, you know, I feel like I'm being pushed out the door. I feel like they're wanting me to leave. And I was tempted to say, oh, no, that's not true. No, and make her feel good in the moment. And her mentor looked right at her and she said, you're right. I think you're reading those signs accurately. For whatever reason, I think it's no longer a good fit. How can I help you? That was so powerful to me, because I was going to leap into my, help you feel good. And her mentor really said, wait a minute, here's the way I read it. This quote by a colleague of mine from Oregon, Chuck Hilo, talked about his experience with the best mentors and what he looked for and what he hoped to provide to his mentees. So where do we find good mentors? If you're thinking, I could use a little assistance, and again, this is not to negate that we might not learn new skills, we might not learn how to do some of the 2,000 sessions I heard that you have here, so there is a lot of teaching and helping and coaching and counseling here at this session, at this SCCM meeting, and also opportunity to maybe seek out people who you think could help you on that next path. So obviously, within our own professions, there are ample opportunities for mentors, people who can help us on that next part of the path as we define the next career, or maybe even life, but career advancement. From another profession, and this was from another colleague, a physician colleague, and to those of us who've been in the ICU in the early days of the not so early, sometimes the person that helps you the very much over a very stressful period of time, obviously not teaching you skills necessarily, although I remember we used to be able to teach the residents very well that before you pull a chest tube, come and get me so I can administer pain medication so it's not unbelievably painful, unnecessarily painful. So I did teach that skill to the residents. But another profession can sometimes be that guide during a particularly challenging part of our career. Another industry, I'd mentioned about the idea of maybe sitting down with somebody from business or administration to gain new skills if you're moving into a track that is more administrative, or maybe some of you are moving into ethics. And so to have a mentor who is in the discipline of ethics would be very appropriate and very helpful, and good to have an intentional relationship rather than just kind of stand by the person and learn from them. Make an intentional request. A couple of other examples from my career that I hope might spur your thinking about who might be able to be a mentor. The CEO of Aurora Healthcare, Nick Turkle, has instituted a process called reverse mentoring. And so what he has done is make sure that each one of his senior administrators in the senior leadership team has a millennial who is mentoring the senior team, every one of which is much older than they are. Some could be their grandparents, much less their parents. And so they have a structured relationship, and they design it themselves. It's not like every Tuesday you're going to meet from 10 to 11. But the two get together, and they talk about what would be a good time and what might the senior exec want to learn, and what could the millennial share with them about how they think, what would make for a satisfying work relationship, give them some connection with senior management. So reverse mentoring, I think, is a good option. My personal favorite, I guess, because it's helped me so many times, is to learn from somebody with whom I had the word bitterly disagree, and I changed it because that sounds kind of strong. So I said strongly disagree. But when I was being interviewed, I should say, when I was being interviewed to get on the board of AARP, 10 people sitting around a table, most looking friendly, one man obviously not happy with me, just sitting there like this, and mouth was in a snarl like this. And I thought, he doesn't even know me, and he dislikes me intensely. But being the good nurse, I could read his body language, but anybody could, because he was just like this. So I sat there in the circle as they asked me questions, and he asked a question. He was a senior vice president at Saks, so we had no health care in common, and he really didn't understand academic nursing or medicine. So he said to me, asked some question. I couldn't even tell you what it was. It sounded like a little bit of a bait, but I just wasn't quite sure. So I said, well, that's really a good question. You know how you do that when you're trying to draw out the time so you can come up with some answer that doesn't make you look like a total fool? So I started saying, oh, that's really a good, and before I finished, he literally lunged and he said, I don't care if it's a good question. I want a good answer. Just like that. So that took me aback. And I remember thinking, this is so not personal. He does not know me from anybody. And I know my nursing lens went into high gear. And I remember thinking, he's acting like a very angry man who just got a diagnosis of cancer. It's not about me, but he's very angry about something that something triggered in his mind. And I looked around, and the other people were going like this. So I figured this is not normal. He was acting a little outrageous. So I left, and I thought, I'll never get on that board. Well, later in the afternoon, he came up to me and said, I was told I was a little, I can't remember what he said. I was a little abrupt. And I was like, oh my gosh, that's so understatement. He was so harsh. But I said, yeah, I noticed you were really upset. So we talked, and it turned out he had totally misunderstood. He was very serious about a position on the AARP board, and he had seen that I had several editorial board positions, which, as we know, takes sometimes very little time. He thought I was putting a notch on my belt, and so I was going to be on my 10th board. Well, that's not the way it works with editorial boards and stuff. And so we were able to talk. And from that talking and really seeking to understand, I found out that we had really a lot in common. And over time, we spent, because we'd had that very bitter beginning, but then we kind of understood each other, spent some time. He was willing to spend time. That was to his credit and to mine. But he eventually mentored me, and he was the chair of AARP, and he mentored me to become the chair of AARP. Took me under his wing because we had started so dissonant, but then came to a common understanding and talked together. And so that turned out to be, and there have been other times in my experience, in my career, in my life, where people with whom I strongly or bitterly disagree often makes me stop and say, wait a minute, what's at stake here? What's going on? Help me understand. And I've learned something, and sometimes, more than once, come up with somebody who actually turned out to be a mentor, because we started at such divergent, but as we spent time, they weren't so divergent. This next example is from the book Hillbilly Elegy. And I don't know if any of you have read this book. It's a fascinating book about a man that grows up in Appalachia. And he very impoverished growing up, and yet he gets to Yale. He doesn't become a physician, but he gets to Yale and is really very renowned. But what he reminded me, and I'll let you read the quotes, what he reminded me is mentoring can be so much more than our profession or than skills or competencies. he writes so eloquently about the power of this woman. And as it turns out, this woman, Amy Chen, is the woman who wrote the book Tiger Mother. But he talks so much about going into an interview and not knowing at all what to even wear. He describes attending a dinner party, and it wasn't just so that he didn't know the silverware and that kind of a thing, which many people would say, but he didn't even know how to make small talk. And it was such basic things that many of us in this room, depending on our backgrounds, may or may not be, if not comfortable with, at least know there are certain things you do in social settings or certain things you might or might not wear. But it did make me think, for our nursing and health professions and medical students, making not any assumption that because they're in this class, which was very competitive to get in, that they are starting out from a comparable platform of social awareness and social knowledge. And how do they sometimes learn these things? Who can sit down and talk with them? Who can answer their questions? Do we make the culture such, our environments in health profession schools and in hospitals and clinics, do we make it okay to ask questions that people may feel, gee, I should know this if I've come this far? And he really repeats a lot about how he felt he should know some of these things, and yet he didn't. So again, the idea of mentoring in a very broad lens, this book really brought home to me. So finding the right mentor, if you're thinking about, I think I would like to develop, I'm ready for a new pathway. Maybe it's a leadership role in your clinical setting, in the clinical component of care delivery. Maybe it's an administrative role. Maybe it's moving into ethics or into some of the myriad of opportunities that we have now in healthcare today and that are really necessary. I was speaking earlier with a couple of you, and the idea that we can move to any one of a number of roles, but if we are grounded in our profession, and for us here it's critical care, if we're grounded in critical care, that gives us a legitimacy to move into all of these other roles, whether it be law or anything else, because we have experienced the relationship with patients, with their families, forged collaborative relationships, so that grounds us forever. And it's not like we're turning our back on nursing or medicine or pharmacy, but we're extending the influence if we move into system roles or administrative or academic roles or whatever. So the idea that we're continuing to learn and grow, to me, is a very healthy thing. But can we maybe find some people that could help us and share their wisdom? So here are some examples. To be really clear, what is it that we want? And again, it's not so much a skill set. I'd really like to learn how to do X, Y, or some endoscopy. That's really not mentoring. It might overlap with mentoring, but what's the next milestone or the next path that you'd like to take, and who has done a really good job in getting to that point? The idea of really spending time, maybe talking with colleagues about, I'm ready for a change. I just before this session had a delightful conversation with a younger nurse about, how might she think about moving to that next path? She's conflicted a bit because she loves clinical, and yet she thinks, I think I'd be challenged by creating some systems that help everybody give good care. I love working with my physician colleagues. I don't want to lose that. So she's looking at a ton of options. And so I didn't give her the answers. Mentors don't say, here's what you should do. That's not a mentor. But help you sort out, well, you might think about this, or is this a little bit more what you're looking at? But a mentor kind of bounces ideas back and forth, but rarely, maybe never does this, but rarely have mentors I had just say, well, this is what you should do. I know. So that's that mentoring. But what is it that you're wanting to develop, this next phase? And then be as clear as you can to articulate your goals. How much time are we talking about? People love being asked for their opinion, their help. I would be surprised if you approach somebody and they say, well, really, I have no time for you. And so just forget it. There might be some, but then you wonder, is that really a good person anyway, if they are not available to help a budding physician or a budding pharmacist or an experienced physician who wants to get to the next phase of their career. Maybe some of you would want to be mentored to be more active in SCCM or AACN. One of my mentors was Dr. Marguerite Kinney. Dr. Kinney, honey, we used to call her because she's from Alabama. But she mentored me and taught me a number of things, life lessons. Ask for what you want. But then she taught us the second piece. But take what you can get, because you're not always going to get what you want. But ask for it. She taught me a lot of life lessons. And then when she became president of AACN, she brought me right along and helped me get on committees and helped me think about that next level of responsibility. So some of you here may be thinking about that in terms of SCCM or the World Federation or AACN. Then creating some structure. And this is really important. It sounds so basic, let's meet every week. But both people have to feel this is important enough to dedicate time and hold each other accountable. And if somebody's always canceling, then that's probably not a really good indication of success. But really structuring it, so like let's meet in another month or 2 months. It doesn't have to be every week, but I'd like to touch base with you in a couple of months. One mentor that I use, and now mostly on the phone because she's older. But I say, let me give you a call in a couple of months, and I want to talk with you a little bit about And so we outline the parameters, and each one is individual to the two people that are involved. And then treat your communications with respect. And by that I mean, I said about thanking people who were your mentors. Sometimes recognize them when I can in a publication. I'll comment on something I learned from Marguerite Kinney or Claire Fagan or some of my mentors. Or I nominate them for awards. For Rocky, a number of us set up a scholarship in her name at the University of Wisconsin because she was so much a mentor. And so a group of staff nurses that worked with me set up a scholarship for graduate education because Rocky was so passionate about people going back to school. So there are a lot of ways to thank your mentors. Kevin Weiss, who's with the Accreditation Council of GME, another good friend and colleague, said to remember that mentors are people too. We often focus on the mentee, but the mentors, if it's a good relationship, will get something out of it. It should be a reciprocal relationship. It's not just for the mentee, it's also for the mentor if it's done right. Both learn, both grow, obviously different things. It may be a different pace, but every time I've mentored somebody, I've gotten as much, if not more, than the other person. And so the idea is if it's set up right, a reciprocal relationship promoting the career development of both is really the very best kind of a relationship. Now, who should you be mentoring? We often think that a mentor is the mentee going up to somebody and saying, would you mentor me? And that probably is the more common, but really there are people in our midst that we look at and we think, boy, you really are sharp. You are just so ready for that next chapter. Let's work together. Let's see would you be interested in going to that next peak on your career, next plateau? And so it can be initiated. And I learned a wonderful lesson many years ago about professional generosity. And professional generosity is an experience in which one's expertise or assistance is freely given. And there's a gift there's openness and open-heartedness and just a collegiality. And I got this experience. I did write about it, but I can't take credit for it. Someone I was with on a plane many, many years ago, we were sitting together, and it was at a point where I had just recovered from cancer diagnosis, and so she was an oncology clinical director. And she was having some difficulties with her work team, a lot of friction and a lot of problems. So I was helping her in terms of things you might want to sort out or you might want to think about in working with your team, how you might want to hold them accountable. So we were giving each other the flight. I don't remember where it was, but it went by and hours passed, and we were helping each other back and forth. And as we got off, I don't think we even exchanged business cards, but as we got off, she stuck out her hand and she said to me, "Thank you for your professional generosity." And I remember thinking of that phrase since then, because it makes or breaks so many of our relationships and our work settings if we experience or provide professional generosity. It really makes all the difference if people willingly share their expertise and their knowledge and their contacts and their networks. Now, I would also say, I would venture to guess, and I won't have you raise your hand, that we perhaps have all been involved in professional stinginess. Now, what I would call professional stinginess is where superiors, usually, superiors withhold access to information or to resources, or who insist on being a co-author when they've done nothing but delay the publication, or who make it difficult to meet, and they'll say, well, I'm just too busy, or why don't you come on Tuesday? And then you show up on Tuesday with your little dissertation proposal, and oh, they're not there. Oh, they forgot. So, some examples of professional stinginess, which can be spirit-breaking and certainly make you think, am I doing the right thing? I'm trying to get this doctoral dissertation done, but I'm getting no help. And in fact, it's an impediment. So professional stinginess, unfortunately, also exists. So let's go toward the professional generosity and share with somebody likely of the next generation, but maybe not. Maybe it's just a peer that we could share with open-heartedly, willingly, collegially. In conclusion, I've asked you to reflect back on who were your mentors throughout your career. Have you thanked them? Have you demonstrated the appreciation, the impact that they have made to get you where you are today? I hope we've looked a little bit at some different kinds of sources for mentoring than the traditional. There is a new paradigm. And so I hope I've provoked a couple of thoughts about new ways to think about who might be a mentor, and then who could you mentor? If you want to touch the past, touch a rock. If you want to touch the present, touch a flower. If you want to touch the future, touch a life. Thank you. Oh, thank you. I know you have many, many sessions. Does anybody have a comment or something? I don't think we have microphones, so you'd have to probably shout it out, or we could also just break. Well, why don't we just go forth and mentor or be mentored? Have a good rest of the day. Thank you.